hands up. Morning, everyone.
Good morning and
Bonjour, bon après-midi plutôt. Bienvenue à la conférence aujourd'hui. Avant de débuter, nous avons quelques mesures préventives à vous communiquer pour prévenir les incidents acoustiques perturbateurs et potentiellement dangereux susceptibles de causer des blessures. Nous rappelons à tous les participants de garder leur oreillette éloignée de tous les microphones en tout temps. Lorsque votre oreillette n'est pas utilisée, veuillez la placer face vers le bas au milieu de l'autocollant sur la table. Veuillez consulter les cartes sur la table pour connaître les lignes directrices en cas d'incident acoustique. Ces mesures sont en place pour protéger la santé des participants, notamment les interprètes, et que nous puissions exercer nos activités sans interruption. Merci de votre coopération. Madame la vice-première ministre, vous avez la parole. Les ministres devront voter pour votre gouverne. Alors, on prendra une pause et nous poursuivrons.
OK. Merci et bonjour. Je parlerai d'abord de la loi d'exécution du budget et des mesures que prend notre gouvernement pour renforcer le système universel de soins de santé publique. Ensuite, le ministre Mark Holland fera le point sur le nouveau régime canadien de soins dentaires. Enfin, le ministre Randy Boissonnault parlera des efforts de notre gouvernement pour attirer les médecins et les personnels infirmiers nécessaires pour améliorer les soins de santé dans les communautés rurales au Canada. I'd like to start, though, by sharing some good news about our economy. Inflation fell to 2.7% in April, down from 2.9% in March. That is 4 months in a row that inflation has been within the Bank of Canada's target range. Inflation has fallen to its lowest level in 3 years, and wages have now outpaced inflation for 15 months in a row. This is really good news for all Canadians. With our fiscally responsible economic plan, our government is doing everything we can to support the Bank of Canada and to help create conditions that make it possible for the bank to lower rates as soon as possible. Today, members of Parliament are debating the Budget Implementation Act, and tomorrow, members will vote on this important legislation. The Budget Implementation Act would put into effect many key measures from this year's budget, including a guarantee that the Canada Health Transfer will increase by at least 5% per year until 2027-28. This will be done through annual top-up payments for provinces and territories that are taking steps to improve the collection and management of health data. This year alone, provinces and territories are receiving $52.1 billion from the federal government through the Canada Health Transfer. This is the largest amount ever. Cela équivaut à $1 milliard par semaine, chaque semaine, pour les gouvernements provinciaux et territoriaux, afin de les aider à financer les soins de santé des Canadiennes et Canadiens, peu importe l'endroit où ils vivent. Et l'année prochaine, le gouvernement fédéral transférera près de 55 milliards de dollars. L'année suivante, ce sera 57,4 milliards de dollars. This support for our healthcare system is going to make a real difference in the lives of Canadians from coast to coast to coast. It's going to mean shorter wait times for surgeries and in the emergency room. It's going to make it easier to see a doctor or a nurse practitioner so all Canadians can get the care they need when and where they need it. We know that these are real priorities for Canadians across the country, and that is why I would really like to take this opportunity to urge our fellow MPs to pass the Budget Implementation Act as soon as possible. Nous sommes conscients que certaines personnes comme le chef du Parti conservateur, ne partage pas nos priorités. Pierre Poilievre a déjà voté contre ce budget et il s'apprête à voter contre la loi d'exécution du budget. The Conservative leader has also said that he opposes, and he's voted against, making the very wealthiest pay their fair share so that we can afford to make these necessary investments in our healthcare system and deliver the opportunities younger Canadians deserve. The reality is that the Conservative leader doesn't care about making sure Canadians can see a doctor or a nurse practitioner when and where they need to. He doesn't care about fixing the real urgent pressures in our emergency rooms, operating theaters, and pediatric hospitals. Alors que le Parti conservateur cherche la moindre excuse pour réduire les investissements dans les Canadiennes et Canadiens, notre gouvernement agit maintenant. Et il le fait résolument. Parce que les Canadiennes et les Canadiens comptent sur nous. Merci beaucoup et je cède maintenant la parole au ministre Mark Holland. Over to you, Mark.
Merci beaucoup, Chrystia. C'est un grand plaisir d'être ici avec vous et aussi avec Randy, de parler un peu sur les questions de notre système de santé. Et c'est une occasion vraiment historique parce que c'est le changement, tous les changements avec les provinces et territoires représentent le plus grand changement dans notre système de santé, dans l'histoire de notre système de santé. Et les investissements sont importants, oui, de s'assurer que le système de santé est là pour toute la population, généralement, mais aussi c'est vraiment une question de la croissance économique et la productivité aussi, à mon avis. D'avoir un système de santé qui est là pour chaque personne dans chaque province et territoire est essentiel. Et quand Chrystia a parlé sur les questions d'investissement d'argent, l'habilité d'avoir les indicateurs communs partout au pays, de voir dans les données le progrès dans notre système de santé, de voir le progrès dans chaque juridiction, c'est absolument essentiel. And so it's important to see these investments not as, individual boutique political investments. They are part of a strategy to transform our health system. 70%, imagine that. 70% of chronic disease is preventable. So much of what fills our hospitals and strains our healthcare system is a direct result of us not making early investments upstream. So yes, we have to tackle the crisis of right now, but we also have to be upstream transforming our health system for the future. And as I said, the investments that we're making as a government, and I'm so proud to be a government that understands this, are the biggest transformation our health system has undertaken since it was first put into place. And let me talk a little bit about that. It starts with tackling the crisis of the now. Every country all over the world had an exceptional challenge when it was hit with the full gale-force winds of COVID. And under the strain of that system, we had a health workforce that stood up like no other. Their courage in the face of extraordinary adversity, the work that they put in, the level of cooperation that they sought, the quickness with which they responded, I think becomes an inspiration to us all to show what is possible when we set aside questions of whose jurisdiction is what and whose ego or what partisanship is there and move with one common purpose towards transformation. And the investments that we made in the Aging with Dignity agreements for improving lives for our seniors, or the money that we put in the Working Together agreements, don't just mean more doctors and nurses. They mean better health data, better sharing of information. They mean transformation, less administrative burden. They mean faster recognition of international credentials. They mean better cooperation writ large. And that's what you're seeing. I just had a meeting last week with all of my provincial and territorial partners, health partners, where we're squarely focused on what we can announce in the fall to continue that momentum and progress. And so in a very practical sense, when we're talking about that $200 billion investment, let's see what difference that's already making. You know, in Ontario, 700 new spots to train doctors and nurses. In Nova Scotia, 88% of rural and remote people in rural and remote areas will have access to primary care over the next number of years. In Alberta, a new e-referral system that's going to make sure that we have better sharing of health data. And of course, those stories are all across the country. So let me move to talk to you a second about a really critical investment that we're making in dental care, which is part, again, of prevention, of making sure that when we have good oral health, we don't have people winding up in hospital rooms. You know, nearly 2 million seniors now have signed up to participate in this program. 9.5 thousand providers across the country have signed up, with more signing up every single day, and of course a new portal coming on July 8th, which we'll see an explosion in numbers again. But let's talk practically who's already received service and what that means. 90,000 seniors across Canada have now received service just since this program began on the 1st of May. To put that in very real context, I was over in Vanier just a couple of weeks ago and met with denturists who met with I'll just pick one person, a senior who for 41 years had the same set of dentures in their mouth. All that remained in her mouth was a plastic plate that she had to use to crush her food. And I think we have to ask the question when we debate these issues, what kind of country do we want to live in? In just about a week's time, because it takes about 3 weeks to fit a new pair of dentures, for the first time in 41 years, that senior will have a new pair of teeth in her mouth. Imagine the dignity that flows from that experience. Imagine the change in her health outcomes. So we can talk about numbers, but when you practically look about what this means and what kind of fair and just country that we want to have, this is huge. And how can we have the best healthcare system in the world if we say 9 million Canadians, a third of our population, doesn't have access to oral health care? So this is a critical move, not just for social justice, but what it's going to do to make sure that people have their mouths in a good state of health, to avoid hospital visits, to avoid the cost of an unnecessary procedure or a deterioration. Just lastly, and I know I'm being long-winded, but I'm excited about this because when I was out in rural New Brunswick, I had a dentist say to me, you know what, I know the people that don't have oral health care. And I'll tell you exactly what happens to those people. I watch them deteriorate and deteriorate until they wind up in a hospital room, and I get a call on a Saturday that I have to leave my family to go into a hospital to do a procedure that I won't be paid for, to fix a situation where that person's life is in jeopardy in a circumstance that was entirely preventable. What's the cost of that? And what kind of society do we want to live in? I think these are fundamental questions. Similarly, on pharmacare, I'm having extraordinarily positive conversations with all provinces and all territories in preparation to make sure that all folks with diabetes have access to the medications that they need. And let's be very practical about that. When I'm going and visiting diabetes clinics and I hear nurses say, I have patients who've lost limbs because they weren't able to manage their diabetes. I have patients who are reusing syringes at risk of bloodborne diseases because they can't afford the apparatuses. I don't think we want to live in that country. And this is an extraordinary chance to make sure that everybody has the preventative medicine they need, not to wind up in an incredibly costly state, but also to make sure that that person is avoided all of those outcomes from a cost perspective. You know, improperly managing diabetes, this is costing us tens of billions of dollars in this country a year. Being upstream and properly avoiding that cost, what it means to productivity, somebody being able to be at work or avoiding the cost of being in a hospital, is huge. So too is with contraception. You know, in contraception, BC brought a universal contraceptive system. They were able to show in the first year it saved more money than it cost. And it also gives us an opportunity to talk about sexual health. And I think as a country, we need to have a very direct conversation about that. I don't think we should allow people to take 3 contradictory positions at the same time. How many politicians are against abortion, against universal access to contraception, and are against sexual education? So what are you saying to a young woman if you say you can't have an abortion, you can't get access to contraception, and we're not going to talk about your sexual health or give you sexual information? It seems to me that the real underlying issue is to take away women's autonomy and control over their own bodies, and that we need to have a discussion about that, making sure that we're in a country where we loudly and proudly say to every one of our daughters and sisters and mothers, your body is your own. The only person who controls your body is you. And that to hide in shadows and pretend that it's about something else and to try to take these issues one at a time is not something we're going to allow you to do. That we're going to talk about women's sexual health as a comprehensive and full package to illuminate those who are standing for women's sexual and reproductive freedoms and those who are not. And at a time when women's sexual and reproductive freedoms are under assault all over the world, that is not a debate that we are going to shy away from. And of course, we're taking critical action in health product shortages with the investments we're making in Budget 24 to make sure that our supply management capacity is there, that Canadians can get access to the drugs and medication they need. And I've got a lot of other things I could talk about. But I know that we got to get to questions. But look at the action we're taking in research in the Bouchard report. Look at what we're doing on marketing to kids, what we're doing in front of pack labeling, with action on nicotine, with interoperability, with personal support workers, drugs for rare diseases. And of course, Randy is now going to talk about foreign credentials and about loan forgiveness and some of the other areas. Altogether, this represents transformational change for our health system. And I can't be more excited to talk more about it, and I hope there's lots of questions. But with that, Randy, I'll turn it over to you.
Thanks very much, Mark. I love your energy. Deputy Prime Minister Chrystia, thanks for the invitation to join today. We are meeting on the traditional and unceded territory of the Anishinaabe Algonquin peoples. Bonjour tout le monde. Canada's economy is in a good position to outperform our peers moving forward, and by some distance, just like the Oilers did last night. You know, I'm the MP for Edmonton Centre, huh? Il fallait le dire. Félicitations aux Oilers. Là, on continue vers la Coupe Stanley. Look, I think what you heard from the DPM, from Chrystia and from Mark, is a fundamental conversation about dignity. And what I want to talk about today is how we make sure that the 21st century workforce is a workforce that treats everybody with dignity. And what do I mean by that? I mean, we've got we've got the best amount of investment right now. We are attracting investment to this country at a pace that we have never done before. First in the world in terms of foreign direct investment, when you divide the investments by our population. That has never happened in my lifetime. Companies are noticing because of the investments we've made in people, in infrastructure, and who we are as a country. Et les entreprises se tiennent compte du fait qu'on a un écosystème ici qui vaut la peine et qui vont pas seulement valoriser leurs employés, mais qui vont les aider à vraiment bâtir un avenir sûr pour pas seulement leurs entreprises, mais les gens qui travaillent chez eux. Just last month, we have Honda's multi-billion-dollar plans and the announcements on that. And why am I talking about EVs and infrastructure and investments at a time when we're talking about health? Is because it all connects. Because people who are building up our infrastructure and our ecosystem, our green ecosystem, our EV batteries, also want to have access to a first-class healthcare system. And that's why foreign credential recognition is so important, because we have people that have been trained to be dentists and physiotherapists and pharmacists and nurses in other countries. We have people ready to build houses here in our country to work in these plants, and yet they can't do the work. Ils sont pas reconnus parce que leurs titres de compétences sont pas reconnus ici par les provinces et par les organismes qui gèrent ces compétences sur le terrain. And so for us as a country, that is an increasing challenge, and we have to focus on that last point, and that's why I wanted to share with everybody here that the Foreign Credential Recognition Program is designed to reduce barriers to joining the workforce so that skilled newcomers can successfully join our workforce and our labor market and play their part in growing Canada's economy. Since 2015, the program has invested over $270 million in 115 projects with provinces, territories, associations, First Nations governments. Why do we do this work? Because we want people who are here living right now with us, doing survival jobs. We want them to have the jobs that they were trained to do in the country of their origin, and we need the regulatory bodies to come on board and recognize those skills. I'll say this to Chrystia and Mark. I was so thrilled in my briefings when I realized that I was the minister responsible for foreign credential recognition. And then 3 minutes later, they said, but minister, you have no power. You have money, but the power is all with the provinces. And with 630 guilds that regulate 275 professions. Think about that, 630 guilds that regulate about 275 professions, some professions more than one body that regulates them. And so our job, with the money that we put on the table, And I did this earlier this year in February in Winnipeg, $86 million to help 6,600 healthcare professionals educated somewhere else in the world, living here already, to be able to practice those skills. Did you know that 50% of our dentists are foreign-born in this country? And it was taking 2 or 3 years to scope a new dentist into practice. With the money that we put on the table with the Canadian Association of Dental Faculties, that is now down to less than a year. And what's happening is the provinces that are getting on board and making sure that the recognition of competencies happens faster, the labor market is going to gravitate to those parts of the country. Now, there's also something to recognize the people who've stepped up to be in this space that Mark talks about, to be in the healthcare space. So we're doubling the amount of money on loan forgiveness for doctors and for nurses. So for docs, we're going up from $30,000 to $60,000 if you practice in rural and remote Canada. Same thing for nurses. We're going up from $15,000 to $30,000 if you practice in rural and remote Canada, because Canadians who live in rural and remote parts of the country deserve access to a prime first world healthcare system, and that means they need the professionals to be in their community. So after you've practiced for a year in an area of the country, you can actually claim this loan forgiveness. But there's more. We are now, as of Budget 24, going to scope in a whole bunch new professions. So I'll give you an example. Dentists, dental hygienists, pharmacists. We've got teachers, social workers, peer support workers, physiotherapists, and psychologists, just to mention a few. And the amounts will be determined in the months to come. Why? Because it's a fundamental question of dignity. And it's a fundamental question of making sure that people who have the skills that can help us build up the country and be part of our healthcare system have access to that. This is a full Team Canada approach. On a besoin des provinces, on a besoin des associations qui gèrent les professions. On est là pour bâtir le pays. Et en ce qui concerne les argents qu'on va donner aux médecins et aux infirmières qui font leur travail dans les régions éloignées et rurales ici au pays, ils vont recevoir 60 000 s'ils sont médecins qui pratiquent dans une région rurale, et pour les infirmières, c'est 30 000 sur leur prêt. Et on va aussi ajouter énormément d'autres professions dans le budget 25 parce qu'au bout de la ligne, c'est fondamentalement une question de dignité, et c'est ça qu'on va mettre sur la table comme gouvernement.
Is voting now? No, we have time. Okay, so we will begin with questions. As is our custom, it will be one question and one follow-up for a reporter. We will start with questions in the room before moving online. Colleagues online, if you have a question, please use the raise hand function on Zoom to indicate that you do. For now, we will start in the room with my colleague Boris. Go ahead.
Bonjour, ma question est pour Mme Freeland. La Cour pénale internationale, le procureur de la CPI a demandé un mandat d'arrêt international contre Benjamin Netanyahou. Si jamais elle va au bout de son processus, est-ce que le Canada est prêt à mettre sous arrêt le premier ministre d'Israël?
Merci pour la question. Le Canada respecte le Cour international, qui est une institution multilatérale indépendante. Le Canada condamne sans équivoque l'attaque terroriste du Hamas du 7 octobre contre Israël. Le Canada appelle pour un cessez-le-feu immédiat, incluant à Rafah. Et nous comprenons le niveau de tragédie humanitaire qu'on voit aujourd'hui à Gaza. Et finalement, pour le Canada, ce n'est pas correct de faire une équivalence entre les leaders d'une organisation terroriste et les leaders élus d'une démocratie.
En suivi, pour les Canadiens qui vous ont vu condamner la Russie et son invasion de l'Ukraine depuis maintenant, plus de 2 ans, qu'est-ce que vous dites aux électeurs qui pourraient penser que vous êtes moins scandalisés par les actions de l'armée d'Israël en Palestine en ce moment?
Le Canada est très, très clair. Nous condamnons l'attaque terroriste du Hamas contre les gens innocents, contre les gens d'Israël du octobre 7, nous appelons aujourd'hui et nous avons pour beaucoup de temps appelé pour une cessez-le-feu immédiat, incluant à Rafah. Et nous comprenons qu'il y a aujourd'hui une tragédie humanitaire à Gaza qui n'est pas acceptable.
Chrystia Noël.
Bonjour, Mme Freeland. Permettez-moi de continuer dans la même lignée et d'insister un peu. Vous dites, on respecte la Cour pénale internationale. Et en même temps, vous dites qu'elle fait une erreur en faisant une équivalence entre le Hamas et un gouvernement dûment élu. Donc, accueillez-vous favorablement ou défavorablement la demande d'un mandat d'arrêt?
Merci pour la question. Et pendant les négociations d'Alena, j'ai compris que pour une leader, ce n'est pas une bonne idée de répondre aux questions hypothétiques. Et c'est une question que vous posez, oui. Oui, vous posez une question concernant une chose potentielle dans l'avenir. C'est une question hypothétique. Nous sommes très, très clairs concernant la Cour internationale, qu'on respecte la Cour internationale. C'est une institution multilatérale indépendante. Et le Canada respecte la Cour et ses décisions.
Bien, je vais être obligé d'insister, parce que ce n'est pas une question hypothétique. La demande de mandat d'arrestation existe. Elle n'a pas été encore accordée, mais la demande existe. Est-ce que vous trouvez que le procureur qui a fait cette demande-là est en train de errer?
J'étais très claire. On respecte la Cour, on respecte les processus qui sont en train maintenant dans la Cour, on respecte l'indépendance et l'objectivité du cours.
Greg Quinn.
Hello, Minister Freeland. I'd like to follow up about your remarks about inflation. The overall rate is slowing. Even grocery prices have slowed substantially. But Statistics Canada noted today that over the last 3 years, grocery prices are up 20%. That's probably still painful for many Canadian families. Is there a risk here that your government is not going to get the full political credit for inflation slowing down here because of what people see on the shelves?
Look, thank you very much for the question. I do think, as I said in my remarks, that the inflation number that we got this morning is really positive for Canadians and really significant. It's a big deal now that inflation has fallen to its lowest level for 3 years. It's a big deal that for 4 months in a row, inflation has been within the Bank of Canada's target range. It's a big deal that wages now for 15 months have outpaced inflation. And all of those things are a big deal for me because they're a big deal in the lives of Canadians. And we know that things are really challenging for Canadians right now, and they've been challenging for a while. Seeing this, 4 months in a row inflation in the Bank of Canada's target range is good news for all Canadians. And I think all Canadians should applaud that. And I will also say, we have been very intentional about putting forward an economic plan which is fiscally responsible. In the fall economic statement, we put forward an economic plan that included some very specific fiscal guideposts. And we did that because we recognized that it was important for the Bank of Canada that the federal government put forward a fiscally responsible plan. After the fall economic statement, the governor of the Bank of Canada said those guideposts were helpful. We recognized that that was the case, and that's why it was so important for us in the budget to put forward a plan that respected those guideposts, because we knew that in doing that, we would be helping to create conditions that made it possible for inflation to come down which in turn create conditions that will make it possible for interest rates to come down. And we recognize that those two things are absolutely central in the lives of Canadians. So, that is really our focus.
I'd like to turn to something global now. Across many large economies, natural birth rates, domestic birth rates have fallen to record lows. Canada has come to that point as well. So now that we've pulled back on immigration, a lot of the foundation of the economy is a growing or at least a stable population. If immigration is being pulled back, is there any kind of rethink about what to do now to keep Canada's population stable rather than seeing it kind of fall into decline?
Well, I'll say a couple of things about that. First of all, it is really important for us as a government to support children in our country and to support families with young children. That is why I am so glad that we have in this budget put forward for the first time a national school food program. That is why I am so glad that this budget includes further investments in the historic system of early learning and childcare, which is going to bring fees for early learning and childcare down to $10 a day. And that is why a centerpiece accomplishment of our government has been to put in place the Canada Child Benefit, which has lifted and is lifting hundreds of thousands of children out of poverty. And I think a central obligation of our government and a place where we have really focused investments is on young children and on the young parents of young children. With regards to immigration, one of Canada's fundamental economic strengths, and I think one of our fundamental social strengths, is that we are a country that recognizes the value of immigrants and immigration. We're a country that is good at welcoming new Canadians. And I think that's a great thing. It's also the case that for us to be able to welcome new Canadians, we have to be sure that one critical condition applies, which is we have enough homes for them. And that's why our government has taken some critical steps over the past few months to be sure that the number of people coming to our country and the number of homes are in balance. Things like the limits on international students, acting where we saw by some institutions in the country real abuses of the system, acting to, for the first time, put a limit on and quantify the number of temporary residents in the country. So we recognize there has to be a balance. We've taken action to ensure there is a balance. We also absolutely believe in and recognize the value for Canada, for our economy, for our society, of welcoming new Canadians and continuing to do that. And some of the things Randy was saying about foreign credential recognition is precisely about ensuring that new Canadians, newcomers to our country, are welcomed and are able to use their skills to help us all as quickly as possible.
I think now is a perfect segue into voting o'clock.
Okay.
So we'll give you guys a minute. We still have about 10 minutes remaining for questions once you vote. Thanks. We'll hit pause.
I can just follow up on that last question as we're coming back. A couple of labor force pieces for you on immigration. 99% of our labor force growth comes from newcomers. And that stable 500,000 that we're going to bring in through the economic class is critical to the future of the country. And by 2032, our population growth will come from that as well. The biggest challenge we have is a mismatch between the 1.2 million people looking to go to work and the 600,000 job vacancies. And so we have to work better with employers, with our provinces, with First Nations, persons with disabilities, people that are wanting to be in the market but aren't in the labor market yet. That is part of our shared responsibility. And when we get to the $50 million that came out of the budget for foreign credential recognition program this year, half of that is to continue doing what we're doing on the healthcare side, but then half is going to go into the construction space. Because we know there are people here right now who have skills from other countries. They just haven't been able to get certified here to do that work. And that's why we're going to make sure that people who live here already, who have those skills, are going to be part of the labor force.
Thank you. Olivier?
Merci. Bonjour, merci de prendre nos questions. Je voudrais revenir sur l'inflation. Vous l'avez mentionné, ça fait 4 mois consécutifs qu'on est sous le 3 %, dans la fourchette donc de 1 à 3 % qui est visée par la Banque du Canada. On peut dire après 4 mois, ou on peut peut-être estimer que ça devient durable. Et ça, c'était un des critères pour justement commencer à avoir des baisses de taux. C'est toutefois pas le cas aux États-Unis présentement, la situation qui est différente pour ce qui est de l'inflation. Est-ce que vous craignez que la banque ici ait les mains liées parce que la Fed n'est pas capable de suivre le même rythme, du moins pour l'instant?
C'est une décision pour la Banque du Canada, mais je pourrais me permettre de citer le gouverneur de Banque du Canada qui a dit quelquefois que la Banque du Canada est une banque centrale indépendante d'un pays souverain et que la Banque du Canada suit une politique indépendante faite pour le Canada.
La question de la Cour pénale qui a été évoquée par mes collègues plus tôt aujourd'hui. On a vu le président américain Joe Biden rejeter vigoureusement cette décision-là. Pourquoi vous ne le faites pas?
J'étais claire dans mes réponses au début de conférence de presse. Le Canada comprend que ce n'est pas correct de faire une équivalence entre les leaders terroristes d'une organisation terroriste et les leaders élus démocratiquement dans un pays démocrate.
Davis?
Awesome. Thanks very much. Minister Freeland, quick question. There's 5 sitting weeks before the summer break. When will we see a bill introducing the capital gains tax changes?
In the coming weeks, and certainly before the House rises, we will begin the legislative process to implement our increase in the inclusion rate.
And so if there's been no second thoughts, what's causing this delay? It's been over a month since the budget was announced, over 3 weeks since C-69 was introduced. Why is it taking so long?
It's important to get things right. And as I said, and let me be very clear, in the coming weeks, and certainly before the House rises, we will begin the legislative process to increase the capital gains inclusion rate. But let me also take this opportunity to point out that all members of Parliament, all political leaders in our country are going to have to make some decisions and take some clear positions when it comes to what is a fair and responsible economic plan for our country. In the budget, we've put forward a plan for fairness for every generation, a plan that invests massively in housing, a housing plan which is bigger, more substantive, more consequential than any housing plan any government of Canada has put forward to get nearly 4 million new homes built. A plan that invests massively in affordability for Canadians, including measures that Mark has been describing, like investments in dental care, like investments in free prescription contraceptives and diabetes medicine, because we know Canadians need that. A plan that invests massively in our country's economic capacity, with things like a $5 billion investments in students, PhDs, researchers, our universities, like a more than $2 billion investment in AI. And we're doing all this because we know it's what Canadians need, and we're doing it in a fiscally responsible way because we know that that's really important in the fight against inflation and the quest to make it possible for interest rates to come down. And so to finance these essential investments, you know, like the healthcare investments that Mark spoke about so passionately, what we're putting forward is a plan for tax fairness for all Canadians, a plan for fairness for every generation. And I have certainly observed over the past week the Conservative leader equivocating, dodging, deflecting when asked about his position on our plan for tax fairness. It is important for Canadians to insist on a clear answer from the Conservatives on tax fairness. And, you know, I think depending on what answer we get, Canadians will know whose side the Conservatives are really on.
Marina?
Minister Freeland, there is yet another example today of Speaker Greg Fergus engaging in partisan events. When does the list become too long, and at one point is it too much for Speaker Fergus to stay in the job?
Our government continues to have confidence in the Speaker. Notre gouvernement continue d'avoir confiance dans le président de Chambre des communes.
Following up on the ICC, the fact that it's looking to lay war crime charges, knowing this, does Canada need to further cut ties with Israel?
I've answered those questions clearly, but let me just say Canada respects the independence of the ICC. It's an important multilateral institution. We condemn unequivocally the October 7th attack by Hamas, the terrorist attack on Israel. We call urgently for a ceasefire, including in Rafah. The ongoing humanitarian tragedy in Gaza is entirely unacceptable. Canada also understands that it is entirely inappropriate to equate the terrorist leaders of a terrorist organization with the democratically elected leaders of a democracy.
We just have a few minutes left. We're going to turn to our colleagues online. We'll begin with Mark Ramsey of the Toronto Star.
Hi, thank you for my questions. NDP leader Jagmeet Singh is once again calling for an excess profits tax on grocers, and he's planning to force a vote on that sometime soon. Can you explain if you support that and why or why not?
Our government absolutely believes in fairness for every generation, and we believe that an economic plan that delivers fairness for every generation needs to rest on tax fairness. That is what this budget is delivering, and that's why we call on all members of the House to move forward without delay to get the BIA passed and to move forward so we can deliver these essential measures for Canadians.
Thank you. And as some of my colleagues have done, I'd like to push a bit on the ICC case. You mentioned several times that you feel that this is equating democratic leaders with terrorists. Can you kind of explain the rationale for that? Because their charges are entirely different. For Netanyahu's government, it's starvation of civilians and causing harm to civilians intentionally. Do you disagree with that? How does that equate them to Hamas, whose charges are entirely different?
I've commented extensively, so let me just say we respect the ICC. We respect its independence. It's an important multilateral institution. We also recognize and understand that this is a preliminary step in a process of the ICC.